Hello and welcome. Today we have Dr. Prashanth Bendre with us, a nephrologist, and we are going to have some conversation about how to keep our kidney healthy. Thank you so much, sir, for joining with us. So my first question is, so now we have a lot of screenings that are happening at an early age, and which makes us, understand that prevention is always better than cure. But what is the right age to get our kidney screened, and how frequently should we get it screened?
Yes. So you see, kidney disease normally nowadays the most common causes of kidney disease is diabetes and hypertension, as well as renal stone disease, and on top of that use of indigenous medicines or use of painkillers, which is causing a lot of damage to the kidneys. So if you have any of these conditions, if you have any diabetes, if you have any hypertension, so you should get yourself screened at least annually. If you have a history of renal stones and you have kidney stones which are untreated, or maybe kidney stones are being treated, then you should get yourself screened very frequently as per your doctor. If you are taking a lot of painkiller medicines, or you are taking a lot of indigenous medicines like maybe some Ayurvedic drugs or maybe Unani drugs or some herbal medicines, then also it is better to get yourself screened for kidney disease as frequently as possible, maybe once or twice in a year. So I would not say any particular age at which the kidney disease screening should start, but it depends on the context in which you have either diabetes or blood pressure or kidney stones, or maybe you are taking some medicines of the effects of which are harmful to your kidney. And of course, if you have any symptoms of kidney disease, then you can get screened at earlier ages also. So symptoms of kidney disease are like defects in your pattern of urination, or maybe you are having swelling all over the body, or maybe you are having a decrease in appetite, and maybe you have anemia, which is the blood amount is low in your body. So these are common symptoms of kidney disease. If you have any of these, then maybe you can go for screening of kidney.
Okay. And sir, if you have to suggest, let's say, 3 mantra for a healthy kidney, what would that be?
3 mantras
Yes.
for a healthy kidney. So the 3 mantras for a healthy kidney would be to control your blood sugar, number one, and prevent diabetes. Number two, control your blood pressure and prevent development of hypertension. And the third mantra would be to keep your weight down, eat healthy, live healthy, be active, avoid smoking, and avoid unnecessary medicines.
So, sir, in a nutshell, it's a lifestyle that we have to change to.
Yes, I think it's a lifestyle we have to change, and there are, you see, in our body there is something which we inherit from our forefathers, like diabetes and maybe sometimes blood pressure, and there are some things which we can change, like our lifestyle. So prevention is a combination of both. If you know you have some tendencies or diseases which you are going to inherit or may inherit from your parents or your forefathers, then it is better to be aware about that and go for screening. The second part is your lifestyle. Even if you have inherited something which is going to harm your kidneys, then with good lifestyle you can delay or you can even prevent the occurrence of kidney complication.
Right. Now, sir, the last leg of this conversation, I want to ask is, what is the biggest misconception around kidney health or kidney diseases?
The biggest misconception about kidney health is, number one, that kidney disease is, number one, untreatable. The other part of this myth is that once you develop kidney disease, then there is no cure and you are going to die. The third part of this misconception is there are no treatments, effective therapies available for kidney disease. The fourth part of this myth is that if my family member has some kidney disease, then I am going to have it for sure. And the fifth part of the misconception is that if you go on to kidney treatment, then lifelong you have to take that kidney treatment. Like people say, if you go on to dialysis, then lifelong you have to take dialysis. If you take some medicines, lifelong you have to take some medicines. So these are all parts of a myth which are clustered together around treatment of kidney disease.
Right. Okay. Thank you so much, sir. It was lovely to have a conversation.
Nice talking.
Thank you.